as something that's absolutely critical on top of the foundation of Social Security for adequate retirement income, I think I'd like to also help people understand that you also need to plan for supplemental insurance and additional assets to pay for health care on top of Medicare. That's a real important thing. Medicare was never designed to do the whole job, and I think it's pretty safe to say that no matter what happens with the super committee and everybody else who's going to weigh in on what our entitlements should look like in the future, that Medicare is not going to start paying more for our health care benefits. If anything, we know it will probably be reduced and our cost shares will be increasing. So when we think about preparing for health care and retirement, I think part of the discussion and the conversation with advisors needs to be make it real. Make it real as to what is it that you're going to spend in retirement on health care. And most studies would agree that it's about a quarter to a third of our income will be spent on out-of-pocket health care expenses above and beyond Medicare. And when I try to spell this out for people, I tell them, do you understand that there are Part B premiums in retirement? Do you understand there are Part A and B deductibles in retirement? Even before you ever get to paying for supplemental insurance, you still have cost shares even within Medicare. So it's important to plan for that as well as your vision and hearing and long-term care needs as well. Finally, I would say that the scary numbers that we see today, and this is coming from an Employee Benefits Research Institute study, are that an age 65 couple today with a combined life expectancy are going to need between $158,000 to $271,000 set aside to pay for out-of-pocket health care expenses. And that is assuming that you're only betting that you'll have a 50% chance to have adequate assets for health care and retirement. And then it depends on what level of prescription drug usage you might have in retirement. So at the median side end of using drugs in retirement, $158,000. But if you're having some real compromised health and larger drug expenses, you're at the higher end. And finally, if you really are conservative and you don't want to hedge your bets so much, if you want a 90% chance of having adequate assets, you're going to need between $231,000 and $391,000. So not to scare everybody, but at the same time to understand that this is going to be a very real need and a very real aspect of overall retirement planning that we have to integrate into every conversation with our advisors, with our loved ones, and ultimately to take care of ourselves. Thank you.